Hey y'all, Kayla Mowdy, Doctor of Physical Therapy with another Monday educational moment. Today I'm going to talk about a SNF or skilled nursing facility, or sometimes called rehab. This topic was prompted by a phone call from a friend who had some questions about how the process worked, and it just occurred to me that it's not really common knowledge to understand the process of you or a loved one going to rehab after an illness or hospitalization for surgery or something like that. So anytime that you are ill or hospitalized for an extended period of time, your body is spending all of its energy recovering and getting you better, and a lot of times you are very weak afterwards. Depending on your family support system, you may not have somebody that can come help you out at home afterwards and stay with you and help you fix meals and make sure that you are taking care of yourself and taking care of, period. So that's where rehab comes in. So a lot of times the physical therapist will come into the hospital and assess you for your needs upon discharge. The hospital system is the purpose of it is to get you medically stable. So once you're medically stable, they're going to kick you out of the hospital. They don't want you to stay there too long. It's very expensive. So they're going to want to get you to the next level of care, which is hopefully home. But if it's not home, I just want to rest some fears about the rehab facility. They are located at nursing homes. I get a lot, when I worked in the hospital, I would get a lot of people, oh no, I'm not putting my mama in a home. Well, that's not what this is. Rehab is a short stay. Medicare, I know for sure, which usually, if you're in this situation, you're probably under Medicare, covers 21 days in a rehab facility after a qualified hospital stay, which is at least three midnight nights in the hospital. So the therapist will come and assess you, explain things to you, and make the recommendation of rehab or home based on just a series of questions and kind of analyzing your support system. And then the process here, usually a case manager is called in and they give you a list of facilities to choose from. In a small town like Meridian, there's probably not more than 3 or 4 options to go to, but in Mobile, there's 20-something options. So usually you get to rate 1, 2, and 3 on your preference list. I usually tell people to just choose something close to home. There's going to be good and bad things about all of them. The really good ones are going to be full or hard to get into. So choose something closest to whoever's going to be doing the caregiving so that they can swing by there and pick up laundry or just provide support in learning the process from going from rehab to home even. So choose something close to home is usually my across the board recommendation, and also check in frequently, because if the nurses know that the family is going to be coming by at any time, for some reason those patients tend to get a little bit more attention and better care. So it's called skilled nursing facility. You'll hear it referred to as SNF. It's usually a pretty nice area of the nursing home, usually a whole hall where everybody's there for short stay type of stuff, and then you only stay a certain period of time. You can stay 3 days, 4 days. You don't have to stay the whole 21 days. Medicare just knows that sometimes people take that long to recover from an illness, so they have that benefit because it's actually cheaper for them to go ahead and have someone in a skilled nursing facility in that rehab and get therapy 6 or 7 days a week instead of keeping them in the hospital and high cost of that care there. And also if they go home too soon, they're at risk of rehospitalization and just overall poor health. They don't have as much monitoring. Even if they do get home health's maybe 3 days a week. It's not an everyday around the clock providing meals and making sure that you're taken care of. If you have any questions about this, don't hesitate to call me. I worked in the hospital system for 3 years, and then I also did PRN at the nursing home, so I'm very familiar, 5 nursing homes in Mobile, so I'm very familiar with how the process works, and I wouldn't mind educating anybody on this, but don't be afraid of it is the main thing that I want you to take away from this. Understand the process, choose one. It's a temporary thing. It helps you get stronger faster so that you're able to take care of yourself, or your loved one is able to take care of themselves once they get home. Have a happy Monday. Bye.